Welcome back. Medicare open enrollment is officially underway, giving nearly 69 million Americans the chance to review their health care and prescription plans for next year. This year's open enrollment runs through December 7th. 41 NBC's Tyrik-Wynn sat down with the new head of Medicare, Dr-Mehmet-Oz, to learn how the current government shutdown is impacting the process and how Medicare is working to make sure rural communities have equal access to quality care.
Joining me right now is Dr. Oz, the Centers for Medicare and Medicaid Services Administrator. Today we are talking about Medicare enrollment, open enrollment, and it started on October 15th and runs until December 7th. Dr. Oz, thanks so much for being with me. How are you today?
Doing very well, Tyrik. Thanks for having me on. This is a very important period. You may think you already know what you're going to do with Medicare, but the reality is the plans change, even yours. You ought to compare plans once a year. That's why open enrollment is this once a year extravaganza where you can go into the website of medicare.gov or 1-800-MEDICARE if you prefer to speak to somebody and just go through your options.
I want to start with this because right now we are in a government shutdown. Can you tell us how that may have affected the open enrollment process?
Has not affected the open enrollment process whatsoever. The shutdown affects lots of parts of government, but Medicare is something that both Democrats and Republicans treasure. It's the crown jewel of our social safety net program. So there's been no changes to the program, to the open enrollment process. The call center is open, so come on down.
So this is your first Medicare open enrollment period as the new head of CMS. Can you tell us what's your message to the nearly 69 million Americans who rely on Medicare right now?
Treasure this program. It's yours. You put money into it. It's healthy. We've got wonderful new people who have been out there creating programs that I think will be very helpful to make it a little easier to navigate the system. So Medicare.gov has become a pretty cool place to go and learn a lot about all the options that are available to you and help you compare programs to save money. But if you don't like websites, go to 1-800-MEDICARE. We've got great people there as well. The reality is we've been working hard to reduce the cost of healthcare in America. The costs of the Medicare Advantage programs have come down a little bit. Even some of the pharmaceutical prices have come down a bit. So it's a continuous, ongoing evolution to make sure healthcare is better. And we are focused on making sure it's the highest quality possible. Because, Tyrik, I'll share a little secret with you. The most expensive medicine is bad care. Because you got to pay someone to do the wrong job, then pay someone else to fix the problem, and then pay for the complications. So if you're clever about the doctors you see and the care you're getting, it'll help as well. And we have an option now on the website that'll help you see if the doctors you want to see are inside the plan you're thinking of joining. So that's an extra belt and suspenders protection for you.
That actually kind of segues into my next point because I was going to talk to you about the new updates. Like, what are some of the biggest updates or changes to the benefits and coverage that people should know about around this enrollment season?
Well, for one, you can make your own account. And that means going in there, putting a bit of information. It can even recognize your face if you wanted to do that. So you can just look at the site in the future. But once you're inside the site, because we know the medications you're on, we are paying the bills, we can help you navigate the different options. You can compare plans more readily with yours and someone else's or some other option to figure out exactly what makes the most sense for you. We're even building in tools to help your family help you more effectively by looking at the same site with you.
Got it. And you did talk about comparing plans. So can you tell us, what's your advice to someone who isn't sure to start? Like, some seniors have said that comparing plans can be a little confusing. So any help there?
If you're confused, call 1-800-MEDICARE. You've got very thoughtful agents waiting to help you do just that, navigate a very complex system. There's a lot of money in healthcare insurance. And so companies are trying to market to you. Don't get confused, get smart. And there's always the opportunity, if you have, if you're curious, to go to Medicare.gov and compare the plans by the kinds of doctors they'll provide you, the kinds of pricing they'll give you, other medications you're on, more easily paid for in one plan versus another. All this is very easy to do, and your family can help navigate it with you as well.
A lot of people here, live in rural areas where they say access to care, it can be challenging sometimes. And so how is Medicare working to make sure that seniors in rural communities have access to quality care and prescription coverage?
Well, Medicare, the original fee-for-service Medicare that was created 60 years ago, is in every part of the country. Every rural community has access to this. I'm very focused on rural America. The president has been pushing hard to make sure that we improve the quality of care and access to care. So we're training more nurses. We've got this $50 billion rural transformation fund that we're launching, and Governor Kemp has actively been engaged in making sure that Georgia's applying for its money, and it's going to be used for rural healthcare transformation.
And then last but not least, we do want to close out with this. Obviously, you know, the open enrollment ends in December. Can you tell us what might be some other options in case someone happens to miss that deadline?
Well, there's always a chance to go back in there and find a new plan for yourself if you have to. But, you know, Medicare is available in two major forms. There's fee-for-service Medicare and there's Medicare Advantage. Medicare Advantage is sort of the health insurance version, the HMO version. And so, you know, if you don't pick one or the other, you'll probably stay on last year's plan, or if it's fee-for-service, it's sort of the backup for everybody.
Got it. Well, thank you so much, Mr. Dr. Oz. I appreciate you taking the time to join us. And guys, remember that open enrollment has officially started and you have until December 7th to do that enrollment.